Ketamine is being used now everywhere for the treatment of pain, depression, anxiety, and trauma. There are 5 things you need to know before you consider ketamine treatment for yourself or for a loved one. These 5 things are the history, number 2, the pharmacology, number 3, the different treatment styles, number 4, the controversy, and number 5, the paradigm shift. The history of ketamine originated in 1962. It was originally discovered as a derivative of the PCP molecule. PCP was being used as an anesthetic, however, it suppressed breathing too much. So ketamine was discovered as a lighter, dissociative anesthetic. It is still used today in emergency rooms, in ORs, and on the field for emergency services very safely, and it is FDA approved for anesthesia. Now, we use it off-label for the treatment of depression, for the treatment of post-traumatic stress disorder, and for the treatment of anxiety. It was discovered in 2000 approximately that this substance had mood-improving anti-suicidal effects. Ketamine is very different than traditional antidepressants that work on a dopamine, serotonin, norepinephrine model. This molecule, ketamine, works on the NMDA receptor. The NMDA receptor is involved in learning. So with ketamine, we use it to unlearn chronic negative patterns, chronic negative maladaptive behaviors. So in effect, we're not just working with a cluster of neurons in the brain, we're working with a brain circuit, and it has widespread effects on neurons in the brain and certain behavioral circuitry. Number 3, ketamine is delivered in so many different treatment styles. The most obvious one is whether you go for IV to a treatment center, which is run by typically anesthesiologists, or if you go to a more mental health style clinic where you see psychiatrists, psychologists, and therapists. So those are 2 different treatment styles, and I think a person needs to know themselves, what are they grappling with? If they're dealing with something that's complicated and they have a history of mood disorders, it's probably in one's best interest to work with a psychiatrist, psychologist, clinician who studied mental health in order to maximize the benefits of ketamine. In more of a practice where you get an IV infusion, that's helpful too. However, one needs follow-up from a clinician trained in behavioral mental health in order to get the longest lasting effects and in order to take their treatment to a different level beyond the pleasant experience of dissociating and the drug effects that last up to a week. You know, if you really want behavior to change, you have to work on it consistently. So that being said, you can get IV ketamine, you can get intranasal ketamine, you can get sublingual ketamine, or you can get IM shots of ketamine. It depends on what practice you're going to. It depends on the comfort of the clinician that you're going to, the style that they use. And you need to be comfortable with knowing what style you're going to take. There are people who are afraid of getting IVs. There are people who are afraid of losing control and taking a sublingual pill and not knowing when and how it's going to affect them. There are people who don't like the repetitive use of intranasal, and there are people who don't want a shot. So ask your provider, how do you provide the ketamine treatment? Here in my office, we use intranasal, and I like to use intranasal because the patient controls it and has an idea of how deep they can go and how fast it will hit them. Also, in my office, I'll just show you a little bit around. We have, oh, there's the whale. He helps people go deep in ketamine. And there is the chair that goes to zero gravity to help people to experience the full effects of the dissociative effect, and also to help them relax. So choose your treatment style wisely and know that there are different ways and different modalities of ketamine treatment. Typically, when one goes in for infusions, it's not talking, therapy isn't done. In certain practices, including this one, I talk to people during the whole experience. I mean, it's not plain chatter, it's actually directed at what the person is experiencing and addressing some of the sensations and the memories that arise while this person is in a non-ordinary state of consciousness. You know, it's a floaty, trance-like state. And when I'm working with people, memories arise and feelings arise, things that people aren't necessarily conscious of in the day-to-day. But here, during our intranasal ketamine session that lasts about 2 hours, people are able to unload painful memories and in that process bring light to areas where they were suffering and help them to reorganize their thoughts around it and just bring awareness to it. And then what we do is over time, we rewire, because there's actual neuronal growth that happens while someone is taking ketamine. So we exploit that by learning and using therapy tools during the ketamine experience here in my practice. Now, I do advise people to go to integration sessions, whether they get IM, IN, intramuscular, or IV infusions of ketamine, because the integration post session really helps a person to use what they experienced in the non-ordinary state of consciousness in their life. And we need that. We need to be reminded of what happened during that state and the changes we want to make. And that's how learning occurs. And it does take time. And it does typically take more than one infusion. However, I will say this, for people who are acutely suicidal, a treatment of ketamine can relieve the acute suicidality for 48 hours up to 7 days. Now, that being said, we can do a whole video on suicidality and ketamine treatment, but I'm going to keep it simple for now and move on to the controversy surrounding ketamine. Number one, ketamine was used as a recreational drug. So why are people using it now for treatment? I understand that. That's why we screen our patients really carefully. And, if there is a history of ketamine abuse or of not following through with directions regarding the ketamine, then I'm not helping someone and I have to terminate treatment. For example, if a person is getting ketamine on the street and then coming here for therapy, it's just not going to work. So I advise you to know yourself and talk to your provider about your tendencies and be really straight up with it. The other controversy is it good to do in such a scale? For example, there are companies that have opened and 3 have closed recently because they offer ketamine on such a big scale. Like they have pharmacies where they will mail you the tablet, usually it's sublingual ketamine, and on the screen through telehealth with a guide of questionable, training. On the video screen, they take the ketamine and are monitored. So people have had negative experiences because ketamine is a drug that creates non-ordinary states of consciousness. It can create anxiety. It can create nausea. People can have memories. So know yourself. And if you are using a big company, make sure that you get the follow-up you need. Make sure you get the hand-holding that you need while you're in this non-ordinary state of consciousness. And you can use it to maximize your learning and your growth during this time period. We know that people can become addicted to ketamine, and we know that people can become dependent. However, in my experience, with guidance and with follow-up, patients don't become dependent on ketamine. It's used as a treatment. Now, when it's unsupervised or unregulated, because people feel such relief from their suffering, yes, it's abused, and yes, it can be diverted and used in parties and as a street drug. So I ask people to be very responsible if they're bringing ketamine into their life, and to work with a provider and examine how that's going. And if it's being mailed to you, please put it in a place that's safe away from your kids. Another controversy I think that's important is that we need more studies on it. We need more research on the NMDA receptor, and we also need more research on some of the negative things that can happen when someone does too much ketamine. Now, we know from studying ketamine addicts that there can be liver toxicity and toxicity to the bladder. That has not happened under clinical supervision and for treatment of depression or anxiety or PTSD and, under supervision in this clinic. However, I just want to put it out there. If you go from clinic to clinic to clinic and you aren't being properly monitored, ketamine puts you at risk of liver toxicity and bladder disease, and it's called cystitis. Those are some of the controversies. We can talk about more. Send me comments. I really want to know your questions about ketamine treatment and how to do it the right way and how to do it the wrong way. Because believe me, I've worked with a number of patients who haven't had positive experiences on ketamine, and it was really a bummer. So we explore that. If that's happened to you, I encourage you to talk to a professional who has experience with ketamine and behavioral disorders, mental illness, and human behavior. Talk to someone about that and you'll get relief. To conclude, I want to put it out there that ketamine is a major paradigm shift in how we think about mental illness. It has shifted the thought from catecholaminergic neurotransmitters to NMDA receptors. We're not just thinking about downstream effects of serotonin or dopamine on clusters of neurons. We're thinking about the brain as a group of different circuits running together, which involve multiple chemicals, not just serotonin or dopamine. So that being said, the paradigm shift is huge. And it's very exciting for me to think about practicing psychiatry, to actually practice psychiatry in a time of neuromodulation when we actually can create neuronal growth, new connections, and rewire our brains to work better, to inspire people to live better lives. So those are the 5 things I want you to know about ketamine in order to be an informed medical consumer. Thank you so much for watching, and I'll see you soon.